We are having in the next session, as I said, Dr. V. Vijaya Padma. She is the professor and head of the Department of Biotechnology, Bharathiar University, Coimbatore. She would be talking on the topic complementary therapy through yoga. So I would request Vijaya Padma, madam, to take over the session. Over to Vijaya Padma, madam.
Sir, today I'm very thankful to the AJK College for giving me this opportunity to share my views on the yoga as complementary therapy. As all of you are aware, now we are all going through a pandemic, corona, and we also know that we are leading because of the pandemic and the lockdown and all that, we are all leading a lot of stressful life. We are leading a lot of stressful life. It is a time I feel that we should look for overall well-being, and prevention is better than cure. So we all have to lead a stress-free life. So we are going to talk about alternate therapy, that is complementary therapy. As all of you are aware, yes, when we say therapy, how is it different? How the complementary or alternate therapy is different from the mainstream therapy? Mainstream therapy is for the cure. As all of you are aware, like mainly whenever we fall sick, we think of a doctor, go to the hospital, and how do they treat? Based on the diagnosis. First they look at the patients, see the symptoms, then based on the diagnosis, they go for the therapy. So it is based on it is based on the cure, or finding a therapy for the cure based on the diagnosis or based on the disease. Whereas when we talk about alternate therapy or yoga, complementary therapy, we are basing when this alternate therapy or complementary therapy is mainly based on prevention. So that's what we say, no? Generally, prevention is better than cure. So we can look for ways to improve the overall immunity and create a sense of well-being. So here, alternate therapy is mainly based on prevention. So there are many types of alternate therapies. We generally see for going for naturopathy or things like that. So actually, these alternate therapies are mainly based on improving the overall well-being. So here we are talking about we know that Ayurveda. Then we have naturopathy. We also have Siddha medicine and all those things, where we want to go for therapy based on the nature's what naturally available things. And here we are talking of I chose to talk about yoga as a complementary therapy. So as I was talking, this is based mainly on the complementary therapy is mainly based on our improving the lifestyle. So what is lifestyle? So lifestyle is what we actually how we do our day-to-day functions, how we lead our lifestyle, the behavior, and our activities, and also the food we take, that is a diet and all that. So how do we define lifestyle? Lifestyle is not dependent. We cannot say all people living in all the places are not having the same kind of lifestyle. We say westernized diet and all that. No, so it is based on the time and place also, because we know that what food our ancestors are eating, we are not eating, though we belong to the same place, we are living in the same place, but still we don't follow the same style. And also that's the reason why it is say the lifestyle is a characteristic of inhabitants of a region in a specific time and place. So a particular region and the time and place, they all actually define the characteristic of the lifestyle of individuals living in a particular place at a particular time. So these things, they define the lifestyle of the individuals, and these lifestyles have a very major role on their well-being. So, and what are the unhealthy lifestyles which are happening in the recent times, which are having a say on our life or on our health? So we have malnutrition, unhealthy diet, smoking, alcohol consumption, drug abuse, stress, and so on. These are all the lifestyles which we see around us. We know we have stopped eating. Nowadays, youngsters, they like to eat pizzas and other things. So our olden people, they never used to go out. Eating out is not there. They always used to cook at home and eat. And also we have to incorporate a lot of vegetables, fruits and all in our diet. Whereas now when we go for all these westernized diets, uh, those things, the balanced nutrition is missing in that. So it leads to a lot of complications. Added to that, we also have the emerging new technologies, such as internet and virtual communication networks. We know that it's new technology is always useful, but the problem comes from the misuse and overuse of technology. These things, people get addicted to, to gaming and things like that. No, always being on WhatsApp and all. See, the communication between people is missing. People are not going and doing any, not playing. Children are also doing all video. They want to play video games and things like that. So these things are the problem. So the lifestyle is changing. These things are also posing some challenge, though the technology is for good, but overuse or misuse of it is causing a problem. So all these new, apart from this, we also have the pollution problem and natural calamities. We know about the Amphan, the Saman, whatever, the cyclone or whatever, and we also have the locusts and all, and we have the new pandemic, Corona, which is also is the reason for these webinar sessions. Otherwise, we would have been seeing each other and I would have been presenting to you on the dais or whatever. So these lifestyle has a significant influence on both physical as well as mental well-being of the humans. That's the reason why we have to say goodbye to this unhealthy lifestyle, and we have to go for look for the complement or alternate therapies. So what are these implications of these unhealthy practices or unhealthy lifestyle? They lead to various metabolic diseases, joint and skeletal problems, cardiovascular diseases, hypertension, overweight, anxiety, depression, and so on. So these are all the various problems. You can see what are all the problems it can cause. It can cause insomnia, respiratory problems, PCOD, aging problem, weakens the immune system, causes diabetes, cardiovascular, and hypertension. So these are all the problems of the unhealthy lifestyle. So what do we do? Whenever we say we have a diabetes or hypertension, though it comes with aging, no? After 30, 40, nowadays it is, many people are having diabetes or hypertension or something or the other. So when the first thing what they do, the doctor says is, apart from the diet, they say some diet restrictions. Apart from that, they say you do some physical exercise. When we say exercise, what are all the various options we have? Either to go to gym or do aerobics, or if they are young people, they may go for Zumba or martial arts. But apart from all this, we also have another thing, which is yoga. This yoga it's a system of practices that brings about the harmony and union of the body, mind, and spirit, and gives a sense of oneness. So this is in the next slide. So yoga it's a system of practices, the various postures. So the practice of following all those postures and all, it brings about the harmony. It causes, it brings about the harmony of and union of body, mind, and spirit, and gives a sense of oneness. So this brings about the homeostasis, hormonal homeostasis, whereby all these things are possible. So what now we are talking about how yoga can be a complementary therapy. So it's a very strong candidate for therapeutic intervention, as it has a comprehensive integrated approach which can address multiple factors. So it's a mind-body practice which stemmed from the ancient philosophy, and it improves the well-being and quality of life. And according to the National Center on Complementary and Alternative Medicine, yoga is one of the top 10 complementary health practices. It has low impact and it can be easily implemented regardless of age. Whatever is with the age, we can still practice. And also, that it doesn't involve any cost. You don't have to have, the space required is also very less. Even if you just have a small open place, we can just go sit there and we can practice. So it also, it suits anytime. There is no so much, if you have to go for walking early in the morning when there is no traffic, you should have some walker's path to go by for walking. or a gym, you need so many equipments and instruments and all are required. So all these things, there is no investment required, and regardless of the age, whatever be the age, if you have some complications, you can tell the yoga practitioner. He will he will tell you some exercises, simple exercises, just to for bring about the hormonal homeostasis. There are several postures. So based on our requirement and based on the disease or whatever the problem is, based on that they will give the exercises. When not exercises, different postures or different asanas they will tell us, which will help us help bring about the well-being, or the what do I say, the which can bring about the which can alter the changes, whatever the problem, no, it will be corrected by the correct postures, following correct asanas based on the age and also based on the requirement they will tell you. So it also boosts the confidence and reduces the anxiety. It is also meant for mental well-being. So physical as well as mental well-being and spiritual, all three should be together. Only then it brings about all what do I say, the physical as well as mental well-being, and also the spiritual thing also will be involved in this. Now coming to how this physical exercise and yoga differ from each other. Whereas yoga stimulates the parasympathetic nervous system, exercise stimulates the sympathetic nervous system. In case of yoga, subcortical regions of the brain are involved, whereas in case of exercise, cortical regions of the brain will dominate. Yoga is anabolic, which is conserved. It conserves energy, whereas exercise is catabolic and it spends a lot of energy. So we will fatigue will set in easily. So yoga practices they reduce the muscle tension through their progressive movements, whereas in case of exercise the muscle tension increases. There is a low risk for injury in case of yoga, whereas in case of exercises the high risk for muscle tears or ligament tear, and these things are more easily. People are prone to those things when they do exercises. And yoga also leads to relatively low calorie consumption, whereas exercise, when you are doing a lot of exercises, you need to also have good food, otherwise you will get exhausted. So you need more, you have to have high calorie food you have to take whenever you're going for exercise. Whereas in yoga, no such thing. Whereas yoga is, because it involves a lot of breathing exercises, it is energizing. Whereas in case of exercise, it is fatiguing. And yoga is non-competitive, it's non-process oriented, it's process oriented and non-competitive. Whereas exercise is mostly competitive and goal oriented. You want to do this much, you have to spend so many calories, you have to reduce so much of weight. You have a goal whenever you go for exercises, you have a goal. Whereas yoga is only to calm your mind and you just want to be better. You just want to be here it is more calming, whereas in case of exercise it is more exerting, because you exert more and you fatigue easily. In yoga, there are limitless possibilities for growth in self-awareness, because we involve meditation also. Apart from various postures, regularly they'll ask you to concentrate. You have to sit in one place, concentrate and meditate. When we do all this, we avoid unwanted thoughts. So it is more calming and it reduces the tension. And also reduces expenditure of unwanted energies, and negative emotions and all will be very much reduced. Whereas in case of exercise, you will be exerting more and more tiring it is. So now coming to what's about the history of yoga. Yoga is there from pre-Vedic times, because there's a mention of in Rigveda also there's a mention of Surya Namaskara and all, which is part and parcel of these yoga practices. So it refers to the pre-Vedic period, and we can see based on this based on the history, the yoga origin, based on to understand the origin of yoga, we can divide the period as Vedic period, pre-classical, classical, and post-classical period. Now you can see here Next slide, please. The Vedic period. Vedic period, during this time, mostly the sages, for any knowledge, we used to believe on sages. We used to rely on sages who are dedicated Vedic yogis to teach how to live in divine harmony. So it's all based on spiritualism and all that. So saints they were also gifted with the ability to see the ultimate reality through their intense spiritual practices. They see, in those days there are no scriptures, mainly based on they all have in memory only. So they used to recite Vedas and all that. So it's only there. So only a guru is required for learning anything. Nowadays previously we used to go for books. Nowadays everything has become electronic also. But in those days it was there only in the minds of the people. Those sages, they used to have all the thing, and only through recitation, the Shishya, whoever the disciple of the guru, they will learn from the gurus. So there are no scriptures in those days, the original Vedic period. So later is the pre-classical period. It is a period of formation of Upanishads. These Upanishads, here there are about 200 plus scriptures of Upanishads are formed. So during this time, there are scriptures, that is Upanishads and all have been formed. So here there are mainly three subjects. They deal with the ultimate reality, that is Brahman, we can say Paramatma, and then transcendental self, that is Atma, and the relationship between Brahma and Atma, or we can say Atma and Paramatma. So based on this, mainly about the spiritualism. So all the pre-classical period is based on that. And next is the classical period. Classical period is where actually you can see the Yoga Sutra period. Patanjali Yoga is very, very popular. That is the oldest yoga. So at this time, all the Patanjali Yoga was there. It is about the 2nd century. So in the 2nd century, which is also called as Pauranic period, this is the classical period where all the Patanjali Yoga has originated. And you have the 8 limbs of Patanjali Yoga. They are called 8 limbs of Patanjali Yoga. And then is the post-classical period or medieval period, which we can refer to the present. So the pre-classical period is Patanjali Yoga. Now classical period is the present period, we can say. Here with the yoga is mainly based on, it refers mainly to the present. Previously, people were more spiritual. They wanted to see beyond life. They wanted to see. They were more spiritually inclined. Whereas the yoga is meant for improving the well-being of the individual. So we talk about the present. That means about this body. We are talking about this body, not beyond. So this is the post-classical period. So this yoga, now most of the postures and all are for the well-being of the present, that is this body, not beyond. We are not talking about the spiritualism, not beyond this body. So we are talking about the present. Next slide. Now, okay, you can see this is the slide which shows. Next slide, please. Next slide, please. Yeah. So this period, it shows the timeline of Vedic civilization. So the Vedic period is not beyond 7,000, not beyond 7,000. So it originated, Vedic period originated between 10,000 to 7,000 BC era. So then you can see the Vedic period is actually between after 7,000. So the pre-Vedic period is origin is between 10,000 to 7,000, and during 6,000 to 3,500 BC era, you can see the before Christ era. You can see the Rig Veda and also the pre-Harappan period. It is called the Harappan period. Usually about 3,500 BC, we have the Mahabharat war and other Dwaraka sinking and all that. Now late Vedic period is 3,500 to 2,000. And also we have 1,500 to 600 BC is the Vira, where Buddha, Mahavir and Shushruta. Shushruta is the person who started surgery. So he's a very, for alternate therapy, he is very, very well-known Rishi for Ayurveda period, Ayurveda and all. So now coming to, after that, we have the 300 BC to 400 is Purana period, where Maurya dynasty, Ashoka, Kalinga war and all that spread of Buddhism and all. Next slide, please. No, next slide, please. Next slide. Coming to yoga. Hello? Yeah. The 8 limbs of yoga. We have told that there are 8 limbs of yoga, Patanjali yoga. So what are the 8 principles? They are all based on the principles. Basically, they're based on the principles of self-study, discipline, and dedication. It starts with yama. Yama is self-restraints. What are all the main things? No ahimsa. That means no injury. Satya, truthfulness. No theft. Spiritual conduct. No greed. So these are all how, first of all, our behavior and external moral ethical discipline. First of all, yama. First is yama, the principle of yama. Our first limb is yama. So the first thing is external moral or ethical discipline. It disciplines our ethical conducts. Next is niyama. Niyama is internal or moral ethical strength. How you discipline ourselves. Things to do, coming to terms with yourself. It deals with coming to terms with yourself, dedication, self-study, austerity, contentment, and purity. These are all the various things which you learn from niyama. Next is asana. First, you have to have your ethical, moral conduct should be right. Then you should have a proper discipline. Then asana. Then you have to learn yogic posture. That means through various yogic postures, the body movements are controlled. Okay. So yogic postures, the control of the body. You have a control of the body by asanas. Then is pranayama. Pranayama is proper breathing for vital energy. So the breathing control, it deals with breathing, control of the breath. And then is pratyahara. So the pratyahara is again detachment from the world. So withdrawal of senses from the external world to internalize your consciousness for meditation. That you have to forget about the world, detachment from the world. You should, whatever happens, you should even cut off the thoughts. Okay. Pratyahara teaches us detachment from the external world. And then dharana. Next is dharana. Dharana is concentration. Concentration. It deals with the concentration and extended mental focusing. How you should completely concentrate, and you should be cut off from the thoughts also. First, external world thought. We have said pratyahara is detachment from the world. You don't involve in other things. Next is concentration. You even cut off your thoughts. So dhyana is process of meditation. Just thinking about nothing. You just keep very calm. See, these meditation and all really help a lot, because the negative emotions and other things, only the mental pollution is more dangerous than the actual pollution which we see around. So the next, dhyana. Dhyana is the process of meditation, the principal practice of bringing your mind to ideate on oneness. Just concentrate on one particular thing. So you have to, they say different, you have to concentrate, and they say there are different types of the meditations. So they will say, so in that you have to concentrate on a particular endocrine glands. You can say here, they say you have to concentrate on this particular part. I know you are not able to see me. So this is very important. This dhyana, there are different types of dhyanas. Dhyana is a kind of meditation. No, there are different types of meditations. They will teach you. The guru has to. You have to get activate. You have to get the teachings from the particular guru for doing it correctly. So they actually, all these things are to activate the various endocrine glands which are there, because basically the yoga is to bring about the hormonal homeostasis, through which it brings about the well-being of the individual. So that is one thing. Dhyana is a seventh thing. And samadhi. Samadhi is completely, you can, the person is completely cut off from the world. That is samadhi, experience of unity of consciousness, so as to feel inwardly one with the feeling of infinite peace or cosmic consciousness. They will be completely cut off from the world. And so they'll be like unconscious. You can see, as far as we are concerned, the person will not be receptive. So he has reached samadhi, we say. Next. The next slide shows the various postures. This is only for you because all these postures I'm not going to explain. You can see that some of the postures, well-known postures like, Padmasan, Vrikshasan, and then we have, Dhanurasan, Halasan, Makarasan, Bhujangasan. Maybe at least some of them you might be knowing, Sirshasan and all these things. At the center, you can see the Surya Namaskara. Surya Namaskara, if you learn, even if you don't know all those things, it's okay. But Surya Namaskara, if you learn to do correctly daily, 2-3 times, if you can do some, there are some people who do more number of times, 100 times like that also. But even not that much is not required. But daily, minimum 2 times in the morning, if you do early morning, it'll really apart from some basic foundation exercises are there. Actually, here I was associated with the Temple of Consciousness, that is, World Health Community Center. It is there in Pollachi, and they have branches, yoga centers everywhere. It's not that I'm promoting, but there's nothing wrong in promoting also. Nowadays, yoga as an alternate therapy, complementary therapy, it's very good because of the day-to-day stress we face. It is very good. They teach some basic foundation exercises. Along with that, if you do Surya Namaskara daily, it requires about hardly or half an hour to 40 minutes. You can do in your own house for some time. And also Kayakalpa Yoga, it hardly takes few minutes. So if you do this, it really brings about, you will see the improvement in your own life. So the blood flows correctly because of the proper hormonal homeostasis. When you do this basic foundation exercises and Surya Namaskara, the blood flow to all the organs will be proper, and you will really see the feeling of energized feeling you will get when you do all these things. And especially when you are old, you will see the difference even more. Although even for youngsters it will benefit because it improves the concentration for children who are studying, or for people with stress also, they can see the difference very easily, and it's very good. So I at least tell you to follow the Surya Namaskara daily, minimum twice, along with the basic exercises and also Kayakalpa. Next is what are the different types of yogas which are existing. So you can see the Ashtanga Yoga, Hatha Yoga, Iyengar Yoga, Power Yoga, Jivan Mukti, White Lotus, Integrated Yoga Therapy. There are Ananda Yoga, Kundalini, Ishta Yoga, Krupa Yoga. There are many yogas which are and the key features of each yoga is also detailed here. You can see in this slide later. Next. So what are all the benefits of yoga? So it, benefits of yoga will be, it improves, they improve the heart rate, they strengthen your bones, normalizes your blood pressure, makes you stress free, improves your memory, helps you normalize your weight, and also, it improves the blood flow, prevents joint problems, improves your posture, improves metabolism, and also, it improves your reaction, increases the concentration, and also helps you sleep well, relieves depression, makes you happier, helps you to relax. So overall well-being will be there. So it improves the quality of life and well-being. Now coming to some of the studies which have already taken place based on yoga, you can see that yoga, after yoga, so effects of yoga have been explored in a number of different populations. They have found that it improves for individuals with health condition, various health conditions such as asthma, cardiac conditions, arthritis, kyphosis, multiple sclerosis, epilepsy, headache, depression, diabetes, pain disorders, gastrointestinal disorders, and addiction. So recently, several investigators have studied about the effects of yoga among cancer patients also and cancer survivors. So here you can see some of the other benefits. Next slide, please. The next slide, please. The next slide shows how it improves, yoga improves flexibility, balance. It also helps with anxiety, depression, and decreases stress. So the right side research outcome, no, it shows the particular study title as well as the author's details are there. Next slide, please. So here we can see a particular study where complementary and alternate therapies, whether they improve the quality of life for women with breast cancer. This particular study here, what they did, they used various bioinformatics tools from the database, from the electronic database. Using all these tools, they have seen how many studies have been done for improvement of breast cancer, for how alternate therapy is used in case of breast cancer. There are about 8 relevant studies were found when they did with when they searched with the various bioinformatic tools. They found about 8 relevant studies, and out of which 3 studies were based on complementary and alternative medicine, out of which 3 were on yoga, and 1 on progressive muscle relaxation training and guided imagery, and 1 is therapeutic massage. 6 of 8 studies concluded that complementary and alternative medicine is beneficial. Now here one study by KN and Vaish SK in 1984. Here they studied role of yoga in management of essential hypertension. This study showed involved about 25 hypertensive patients, where they studied only about 20 patients were doing only yoga, the hypertensive patients who practiced only yoga. Whereas in group B, they have taken 5 patients receiving yoga as well as antihypertensive drug treatment. So the result showed that at least 65% of the group A people, 20 patients are there. Now, out of that, 65% of those group A people, they could get, they were cured by practicing asana, yoga only. So here the yoga was Shavasana. Shavasana is nothing but just lying down flat. So this Shavasana, it was useful. So it is calming. The blood pressure is, that people get hyper. So you have to relax. The Shavasana is mainly you just lie down calmly. And so this Shavasana helped at least 65% of group A people. That means 65% of the people got cured by practicing Shavasana only. Whereas about 35% people, they could not be, BP was not controlled just by following this. Whereas in group B, where they tried both yoga as well as this antihypertensive treatment, the dosage requirement has significantly reduced. That means instead of taking a particular dose, you can go for a much lower dose when you are practicing yoga. So definitely yoga is helpful. That means from this study, it is evident that yoga definitely has a significant effect. Although sometimes only yoga may not cure, but it can significantly help in reducing the dosage. So another study here also, Iyengar yoga. So what is this Iyengar yoga? It is named after the developer, B.K. Iyengar. B.K. Iyengar is a particular person who wrote a book on yoga. The name of the book is Light on Yoga. It is published in 1966. It's a bestseller, and many people follow this in westernized countries. And this yoga is based mainly on the detail of precision and alignment in the performing yoga postures. He gives a lot of stress or emphasis on the correct posture. So it's very important for that. So he is very strict on alignment of the postures. So the posture, precision and alignment of the particular posture. So based on that, the book is, so it is very popular as Iyengar yoga. And this Iyengar yoga, so there is this study, a particular study was done where, which involves the effect of Iyengar yoga and enhanced usual care on blood pressure in patients with pre-hypertension pre-hypertension to stage 1. That means just about borderline hypertension patients and stage 1 hypertension. So it's a randomized case control study, and this study showed, that here they found that definitely this when they practice about 12 weeks, 10 to 6 to 12 weeks, those who practiced yoga were much better. They had much better control. Although this enhanced usual care also helps, at the end of the study, they found that this Iyengar yoga is much better. Now coming to another thing, yoga on our minds, a systemic review of yoga for neuropsychiatric disorders. How it helps, whether it helps on for the psychiatric disorders also was studied, and they have, this study involves using various bioinformatic tools to first search how many studies have gone in this, and they found the research yielded about 124 trials, about 124 studies they found, and out of which 16 met rigorous criteria for the final review. So they studied so many studies they have seen, and they found that it benefits the yoga. Benefit for yoga exists in depression as an adjunct to pharmacotherapy in schizophrenia. So, and also in schizophrenia as an adjunct to pharmacotherapy in schizophrenia. That means in schizophrenia, as an adjunct, they have to take medicine. Apart from that, they have to follow the yoga. And also in children with ADHD also they can, and also grade C evidence in sleep complaints. That means, insomnia. Even for that, it is useful. So different studies show that yoga is either completely yoga can cure, or sometimes as an adjunct to pharmacotherapy. So it may help. In most of the studies show that it helps. So no studies looked at primary prevention or relapse prevention or comparative effectiveness versus pharmacotherapy. Now, so there is, so the conclusion is emerging evidence from randomized trials to support popular beliefs about yoga for depression, sleep disorders, and as an augmentation therapy. So limitations of the literature include inability to do double-blind studies, multiplicity of comparisons within small studies, and lack of replications. So biomarker and neuroimaging studies, those comparing yoga with standard pharmaco and psychotherapies, and studies of long-term efficacy are needed to fully translate the promise of yoga for enhancing mental health. So here what they say is, although there are several studies, but still thorough studies within even the comparison within small studies. There are some studies are there, but not thoroughly. With large randomized studies are required to get the proper proper understanding about this, the benefits of yoga. Now, another study shows central blood flow affects yoga training. This is a preliminary study. The conclusion is the initial findings suggest that the brain experiences a training effect after 12 weeks of training, Iyengar training. So here you can see that this is actually, it is well known that experienced practitioners of yoga and meditation, they have been able to alter the brain function. But no one has studied whether any person, even the beginners, when they practice, whether they can get the, whether you can improve the blood flow to the brain. So this was a study where people who have never been exposed to yoga were taught and made them practice for 12 weeks. And they found that they could also, they have the training effect. They can train the brain experience. They also saw the brain experience as a training effect after 12 weeks of Iyengar yoga practicing. So even people who are newly introduced to yoga also can practice yoga. When they practice yoga thoroughly on a regular basis, about 12 weeks, that means minimum 3 months, you can still see the well-being, mental well-being. So the brain training effect also you can experience. That means it's not that only the siddhas and yoga is not only meant for siddhas and yogas who are completely into it. even day-to-day life, people who are going about their daily course, they also can meditate, and they also can get a control of their mind and body. Now coming to now my topic I have come to the Kayakalpa Yoga, a treasure hunt for women. So this is one particular study where I have been talking about the Kayakalpa Yoga and other things which are associated with the World Health Community Center, which is present in the Pollachi. So here Vedadri Maharshi. So to my knowledge, this Vedadri Maharshi's Kayakalpa technique is one of the easiest and effective practice to extend the life force in our body. So this study is particularly about how it helps the PCOD condition. So PCOS is polycystic ovary syndrome. So this particular patient that results because of the hormonal imbalance, because of the some disturbance in the hormones, menstrual cycle and all. There will be a disturbance in the it occurs mainly for women, young women, because of the hormonal imbalance. The levels of FSH and LH, they are not proper. So they have so this particular study focuses mainly on the body weight and balance of this FSH and LH, and also the cholesterol levels, and how the menstrual cycle. So they have which regulate generally the ovarian this thing. So after this practicing Kayakalpa Yoga, while doing this Kayakalpa Yoga, which is generally the recycling of the seminal back mechanism, it is similar to the feedback mechanism of the pituitary gland in synchronizing the hormonal balance. I told you that this particular yoga brings about hormonal homeostasis. That's how it, what do I say, it normalizes. Because of the hormonal homeostasis, maintaining the hormonal homeostasis, all the body functions will be proper and the disease state can be removed. So this is a yogic technique. This yogic technique or Kayakalpa Yoga technique normalize the levels of this FSH and LH after the study they found, and also it reduce other cholesterol level and other things, and brings back the menstrual cycles to normalcy. And it can also, that PCOD condition also leads to infertility. So when by bringing back the menstrual cycle or normalizing the menstrual cycle, the fertility also automatically will come. Now, our findings, impact of yoga on aging. Actually, we have also done a small study on aging. So the Kayakalpa Yoga is a yogic technique which is practiced by South Indian Siddhas and was lost in time and to be rediscovered by Vedadri Maharshi. So Kayakalpa exercise helps in rejuvenating the life force and provides healthy body. So the main aim of Kayakalpa Yoga is to lead a disease-free life, slow down the aging process, and to maintain youthfulness, and also enhancement of longevity. So our findings are, they are the first appraisal, improving the mitochondrial dynamics and function through study of gene expression profile in individuals practicing Kayakalpa Yoga versus non-practitioners. So we did a pilot study, pilot scale study involving individuals of 40 to 60 years, because we saw generally after 40 we say aging sets in. So between 40 to 60 years, healthy individuals we have taken. So we have taken individuals who don't have any chronic diseases, and who are, and also we have seen that they are not, they're not smoking or no consuming alcohol, or no other bad habits, no drugs or no other. So we have taken apparently healthy individuals in the age group of 40 to 60. So and also whenever we have taken people who have never practiced Kayakalpa Yoga versus those who have been practicing Kayakalpa Yoga for about a year or more than that. So we just wanted to see how the the genes which are involved in mitochondrial biogenesis. That means, when you are very active, when the metabolic function is good, mitochondria, actually when we are young, the mitochondrial biogenesis will be good. But as we old, slowly the mitochondrial biogenesis will be slightly slowed down. And also the mitochondrial dynamics, protein, there are some mitochondrial proteins which are involved in mitochondrial dynamics, fission and fusion. So overall, all these things also are important for mitochondrial function. So the mitochondrial biogenesis, is nothing but production of new mitochondria. As we age, the mitochondria will the number reduces. As a reason why the energy levels also will be reduced, and also there will be more mitochondria which are not functional, because too much of, because of the metabolism, continuously mitochondria will be, they are powerhouses of the cell. So much of activity, because those mitochondrial activity generate lot of reactive oxygen species, which induces mutations in the mitochondrial genes itself. Some of the, because of which, though each cell, in the body we have several cells, many organs, and all the organs have cells, and the number of mitochondria in all the cells are not equal. Based on the energy requirement, the number of mitochondria per cell vary. We have in the the more active organ is neuronal system. So the more number of mitochondria will be there in the neuronal cells. Next is muscle cells. Heart, continuously it will be working. So heart will have more cells. Not only a heart, other muscles also, any movement is aided by muscles. So the muscle cells will have lot of mitochondria. Next is the liver, because it does lot of metabolic functions. Next is kidney. Next is pancreas. Like that, different organs have, all of them does not have the same number of mitochondria. The number decreases. And also the mitochondria we get actually from the mother, from the cytoplasm only the mitochondria is there. When the egg fertilizes, more of the cytoplasm comes only from the mother, because the mother egg only has a cytoplasm, whereas the sperm doesn't have much. So the contribution is from the father is less. Anyway, that is not the point here. Now, the mitochondria, the few mitochondria which are there in the fertilized egg, from there all the mitochondria are derived, and also different cells get different numbers based on the energy requirement. And also we have, as I told you, the mitochondrial proteins, the entire mitochondrial, though all of you are aware that each mitochondria has 2 to 10 copies of circular DNA. This DNA has, it encodes only few proteins. Okay, about 33 proteins only it can encode. The rest of the proteins, the mitochondria has more number of proteins. So only the mitochondrial DNA can encode some of the proteins which are required for the mitochondria. Rest of the things are again encoded by the nuclear genes. So the mitochondrial the mitochondrial proteins are in both nuclear encoded as well as the mitochondrial DNA encoded. The problem is with mitochondria is in nucleus, the nuclear genes, when there is a damage, there is a repair process. Different types of repair you would have studied. Whereas in case of mitochondria, we don't have many repair processes. There is no repair only. That's the reason why they tend to get accumulated. So as we age, the mitochondrial function reduces because of the accumulation of the mutations. And also, when we are young, mitochondrial biogenesis will be there. Whereas as we old, the mitochondrial biogenesis will be less. So the less mitochondrial biogenesis, less replication of mitochondria. So the number of mitochondria will be less. And also because there is no repair, the mitochondrial function also will be affected. So that's how we end up having less energy as we age. So sorry, I have given a lot of introduction about this mitochondria, because the main study, our study is how yoga can benefit benefit us. I told you that yoga gives us, it energizes, right? So how it affects the mitochondrial health is what is our study. So we have studied the expression profiles of the various mitochondrial genes which are involved in mitochondrial biogenesis and mitochondrial dynamics. That's our study. And also we have studied how the ROS, I told you in the mitochondria, because of the continuous metabolism, there will be a lot of ROS generation. So that also we studied how it affects the ROS, and also how it affects the mitochondrial function integrity, mitochondrial, how it affects the ROS generation and mitochondrial integrity apart from the mitochondrial biogenesis and dynamics genes. These are the study we did. So here in this pilot study, we have compared those who have been practicing Kayakalpa Yoga for a long time versus those who have never practiced. Healthy individuals itself. Even in healthy individuals, leave about, I leave alone all the other things. I told you, for diseased people also it helps. Even in the healthy people also, there is a lot of difference between practitioners versus non-practitioners. Now, these are the yoga institutes in India. Various yoga institutes like Moraji Desai National Institute of Yoga in New Delhi, Pool Chatti Ashram, Uttarakhand, Parmat Niketan, Uttarakhand, and Yoga Niketan, Uttaranchal. So these are all the various yoga institutes in India. And for further information and training, you can see that these are all the various hyperlinks provided for where you can get more information on yoga training. So for meditation, these are all the hyperlinks and these are the references. Thank you very much.
Thank you, madam. Thank you for your very informative and very extensive speech on the subject. I am sure that the participants have really enjoyed your session, ma'am. Thank you, ma'am.